Dental implants have lots of applications today, but there's some things that you need to think about before you go and have dental implants done. One, do you really need them? Can you save your existing dentition? Like I've mentioned in other videos, we have the ability to regrow bone back around your teeth. But say that you've already lost some teeth or you're about to lose some teeth. Some things you should think about, some things that you should ask. One, whoever's doing the work, how long have they been doing them? You know, we've been keeping records of our implants since 1991. We have less than a 3% failure in placing dental implants, and we place hundreds a year. In the Journal of the American Dental Association, they published a paper just a year or so ago showing that the average, the failure rate of dental implants can be as high as 20% among dentists that are placing implants in the U.S. That's really a lot. It's really significant. So things that you should be thinking about. One, the doctor that you're going to they need to understand anatomy. They need to have the training, not just some weekend course, but have they been through an extensive training process where they really know what they're doing? You know, as part of a residency program, we get in-depth knowledge on not just anatomy, but the functions of the body as well, and how to manipulate the bone and the soft tissue to augment the results long term. Other things to consider is, so I know I need implants, but how am I going to look? How's it going to be? What's the outcome going to be? So in our office, when we're placing dental implants, we do most of our work up front. We'll do an exam. You'll come into the office. I'll check all of your teeth for infection, make sure all your other teeth, your restorations are healthy. Because if you place dental implants in a mouth that has any infection in it, the likelihood that those implants will get infected is high. So that's got to be managed first. And then we look at how much gum and bone you have to place an implant into. And if there's so if you were to take your finger and rub it across your gum where your teeth are missing, if there's a divot or you've lost some volume of when you smile, there seems to be a gap in a certain area, those are areas that we would tend to go back and grow that back first. We can grow that back. We can grow back your gum. We can grow back your bone. Another thing to consider is say, okay, I want to go to somebody who has lots of experience, and I want somebody who's going to prepare the site and deliver an implant to me in the best possible way. How do I maintain it over the course of a lifetime? Because we want dental implants to be a lifetime restoration, and they can be, but they have to be maintained just like your natural teeth. You know, an implant's not impervious to problems. Implants can get infections around them just like natural teeth can. What caused you to lose those teeth in the first place? Was it did some of your teeth break? So that means we've got a clenching or a bite problem that needs to be addressed. Were some of your teeth lost due to gum disease? That needs to be managed first. And then how do you maintain it? How do you manage it long term? In our practice, that's what we do. You know, once you come to see me, it's kind of like we become family, because we're going to, not only are we going to take care of the problem, but we're going to show you how to maintain it for the rest of your life. And we'd like to be a part of that process. You can come back as you can look on some of our reviews. I've got patients that have been coming to me for well over 20 years, and they come back to us because they want us to maintain their teeth, their smile, their gums over the course of time.